Ang COVID-19 ay panibagong kontrabida sa buhay nating mga Pilipino.
Habang unti-unti tayong bumabangon muli, patuloy ang laban natin dito.
Para matalo natin ang kontrabida, we can beat the solusyon!
Kaya mong maging bida, basta susundin ito.
B. Bawal walang mask.
I. Sanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
BIDA Solusyon sa COVID-19.
IMFs nato. So they have learned, no? And then ato pong mga nasa sulod sa hospital are really the cases that needs to be catered to inside a hospital. So I think we are doing it right, but more importantly, I also believe, no, nga sa tabang ninyo sa media, sa atong sige o panuktok sa atong mga katawhan, no, to be able to implement the minimum health standards. And I believe nga ang mga gahig-ulo nato ng mga Subuanon, medyo dili na gyud gahig kaayo. So kumbaga, they have already, somehow inculcated into their minds, no, na they really have to participate in this venture kasi it's the responsibility of everybody. So I would say nga there's a little bit of discipline now and people are more aware and so they are more attuned to the BIDA solution.
Okay. Doc, kadang maayo na nga balita, no? Good to hear. Na ako lang ipaambit na lang, Doc, ang pangutana din nga gihatag sa taga-ABS-CBN because it is in line with kato imong gisulti, no, nga na ang behavior, cooperation sa public has been instrumental in the improvement nato, no, sa mga number of cases and the recovery rate. Ang assessment daw sa DOH, Doc, kung ni-effect ba ang lockdown in the number of cases. Naaba siya impact ang katong pag-lockdown?
Yes, I think so. I believe so, no? Kasi sometimes, manggod, ang mindset sa tao, bitaw, kung naas like kahadlukan, and then natin mga military, no, who's really consistently, religiously taking care and watching them, no, to be able to implement the minimum health standards, I believe it has an impact by itself. Pero also, I also believe na people today are learning also kasi we cannot forever be captive to the virus without us doing what we can do. Because otherwise, mamatay lagi kita tanan sa gutom ni ani kung dili kita magtinabangay. So I believe that the media information drive and then we have the ang atong IATF from Manila, no, having placed here si General Feliciano, no, with Secretary Simato putting into place, no, ang katong mga necessary measures nga kailanghanon, and then our better reporting, the participation of all the hospitals and everybody's effort here, I think that will spell the difference.
Okay. Muna ito yung whole of nation approach ang style gidok, no, nga gikinahanglan sa na nakita nato ang maayo nga resulta. Kunya, Doc, naapay laing pangutana lang kung back to operation na ba daw ang subnational nato nga SNL, ang lab, and are we expecting large samples to be tested if it's back to operation na?
Yes, correct. No, back to operation tayo. We only took 3 days off, no, to be able to do decontamination. Kasi, in any molecular laboratories, you really need to make sure na fully decontaminated ang inyong area because you're dealing with live viruses in order to protect also our personnel, no? But now we are back full operation ta. At ganing Friday, we were already doing our job and then we were also receiving a lot of samples. So I believe the community now are very much cooperative and collaborative with us, wanting to be tested already.
Doc, I know that you have other pressing, grabe no, nga important matters to attend to right after our interview. So before I let you go, Doc, maybe mga health atong advisories na lang, Doc. This is the last week of July. That means another round of assessment na po, no, for the areas in Region 7 kung asa na po sila paingon nga community quarantine by August. So unsa may atong mensahe, Doc, sa publiko?
Okay, so number 1, Miss Rach, no, we are very excited actually, no. I am one with you in our excitement to know nga ma-downgrade ang ato ang community quarantine. Pero hindi natin pwede pangunahan ang IATF at ang CPRRD kasi at the end of the day nasa mga kamay nila yan. But with our data, no, everything that we are doing, I believe it quarantine. However, dapat huwag tayong kampante. This is the time na we need to put everything in place kasi when we are downgraded, economy will start opening up. People will be coming in and out of our place.
Ang COVID-19 ay panibagong kontrabida sa buhay nating mga Pilipino.
And tighten
Habang
everything that we
unti-unti
need to
tayong
do
bumabangon
para
muli,
dili sa
patuloy ang laban natin dito.
Para matalo natin ang
I would be so sad if 2 weeks we will be GCQ and then after that ECQ na sarta. That's going to destroy confidence. That's going to destroy everyone, all of us, no? So I hope and pray na we will continue on doing what we are supposed to be doing, the discipline, the responsibility, the cooperation, the collaboration, and the BIDA solution.
Yes, Doc. Thank you so much for giving us time for the interview, and we look forward to interviewing you again no, sa next week after na announce na unsay next step for Region 7 in terms of community quarantine.
Hi, thank you.
Thank you. That was ato ang spokesperson on COVID-19 no, from DOH Central Visayas, Dr. Mary Jean Loreche. But of course, ang COVID, although we are still in the middle of the pandemic, naapaggihapoy daghang mga health issues nagpadayon gihapon no ang kining ato ang mga usual nato nga mga giatubang nga mga health problems, mga diseases, especially karong panahon na kung kabantay mo nga ano na rainy season na. In fact, I think yesterday ug karon no consistent na nga naanay mga one and then naapud tay weather advisory. I think just this today no na issue ang pag-asa nga naay low pressure area sa ato ang Philippine Area of Responsibility. So munang karon atong pangutan-on ang ato ang next guest from DOH kung unsa man ang kining mga rainy season nato, mga unsa nga mga sakit ang gida usually ug panahon sa tig-uwan no ang kining mga waterborne diseases. So I'd like to ask ang atong medical officer 3 sa DOH Region 7 si Dr. Van Philip Baton. Welcome back, Doc Van. And Doc, unsan man ni ato ang mga Doc, unsa man usually ang mga sakit no that mo report or ma-record during rainy season, Doc?
Hi, Ma'am Rachel. So, usually, pag rainy season, common na dyan ang balik-balik lang ang sipon ng kubo, no? And especially the time of COVID, almost everything is associated with COVID, especially if like fever, like ubo, na sipon, no? So, we actually expect no, that there will be a surge in consultation, mas aware ng mga tao kung saan makasunod sa mga doctors. So, we're also building up our health system to at least cater to this particular increase in cases such as common colds and flu. So aside from that, common sa ato ang rainy season is number one is ang leptospirosis, especially in the highly urbanized centers or urban centers. No, common yung kaayo ni siya. We do not get a year without a case of leptospirosis. No, in the matter of fact, for this year we already have 12 cases recorded, although it's lower than last year. No. I think middle part of the year, we already recorded around 10 cases last year pa lang, no? But for this year, beyond ito we're going towards August, we only had 12 cases. And the last case that we had recorded was June 8, no? So we haven't had additional case for that. And of the 12 cases, no? The 12 cases that we have recorded for this year, 9 of them are coming from Cebu province, but 8 of it are coming from Cebu City, with only 1 from Cebu province. So the rest is 2 from Negros Oriental and 1 is from Bohol. So you can really see the distribution. Usually makita niyo lang kung urban centers, no, common ang flooding, common po lang po ang mga poor irrigation or ang pag-flow sa atong mga floodwaters, labi magulan-ulan. So wala common po siya sa mga heavily congested areas. Number 2, common po ning atong mga leptospirosis na cases, especially in wet markets, no? We actually see a lot of informal workers sa mga markets kung may maapektuhan ang mga lucky, mga laborers, no? Ang mga attend sa mga karga-karga, dali kini sa matakta leptospirosis because number 1, magkapunog lang ang tubig ha. And sometimes majority, if not all of our workers sa mga markets nato do not wear protective equipment, no? So one of our protective equipment for leptospirosis and other waterborne diseases, labi na ang skin diseases, is the water boots. No? Mag-boots yun sila para dili number 1, dili masamad, dali ilang mga tiil, kung namagali mga bildo or mga palilaw sa tubig, dili makita. And then it also protects them if naay sama, dili siya masagulan sa mga hugaw, no? So kontra tetanus aside sa leptospirosis. And we also advise everyone, if ever you need to go to wade-filled waters, number 1, wear boots, no? Rain boots. Also is to wear gloves, no? Especially if you need to clean, no? Labi na sa itong mga garbage truck collectors, no? Manguha og mga recyclable materials, no? They should wear mask para po again. So from tetanus, they will also get leptospirosis because leptospirosis magikan na siya sa ihi, no? Sa ilaga, no? Or sa rats, no? So ano siyang common siya sa mga stagnant waters, no? Mga areas na naghanap ka ng materials that might gather also water. So that's leptospirosis. So based on our data, kasagaran sud sa ato ang mga maigo sa leptospirosis are the working class, no? Ang pinakabata nga na record nato this year is 19 years old. 19, and then ang pinakatigulang
5
na
years.
nakuha nato 19 years old ang atong pinakabata na nakuha for this year.
Oo.
And then ang pinakatigulang is 61 years old, no? And then majority are male. Actually, we only had one female, no, for this year. One female lang tanong at 61 years old. Ang pinakatigulang po nato mo ang babae, no? And so far wala tayo nakita na mortality for this year. So that's really good. Also, I think the protocol of staying at home is really effective in terms of curbing down the number of leptospirosis cases. No? Hindi man kayo manggawas ang mga tao sa market, and then gamay na po na sa operations sa market. That's why we also expect a decrease in cases. No? So that's for leptospirosis. And then of course, ako na pong i-appeal no, ang dengue na to. So of course, kung naapay tubig, especially for clean water, stagnant waters, gabi na kung magpundot ng tubig o wala kay tubig, common po nato expected na natay increasing number of dengue. No? So that's why we also advise our gabi na karon kinata sa balay tanan, no? So wala tay kaayo mabuhat. We advise everyone to maintain a clean environment. No? Clean environment, dapat if ever we need to keep water indoors, i-cover na to ang waters, no? And then, so it's all about, as the same with COVID-19 for prevention, it all boils down to personal responsibility and being aware of your surroundings. No? So again, we cannot do this. And if ever you feel sick, always go to the nearest health clinic so that you can be checked by a doctor. So we do not advise you to take medication on your own, especially if it's antibiotic, because you might do more harm than good. So for leptospirosis, we have a lot of medication available in our health centers. No, it's doxycycline that will be provided for them, or other antibiotic if ever allergic to doxycycline. And then we also have common meds, no, for our flu. And then especially sa atong may elderly o pinakabata, we advise that you go to the nearest doctor or get consult at the soonest possible time, so that dili mo grabe ang imuhang ubusipon, and then you can be assessed if you will be needing swab for COVID-19.
Doc Van, katong sa leptospirosis, this is a deadly disease, right? Makamatay gid
Yes.
siya. Oo. So, ang ano ani is, kung dili siya immediately treated, it can really lead to death.
Yes, no, we have actually leptospirosis, and the complication of leptospirosis is for Wills disease, no? It will affect both your liver and your kidney. That's why makita di mo na kung severe leptospirosis, the color actually goes towards, di siya yellow but more orangey, no? Kaya na siya mga bleeding po, kaya ma-affect mo imong liver, no? Aside sa imong kidney, no? So nakay mga bleeding tendencies, and then yellow ka, and then wala kasagaran mag-orangey ang skin nila, no? And then ang mata nimo is kind of reddish or orangey. So this already is your disease, affected imong kidney that you might need hemodialysis, no, temporarily or permanently if grabe imong disease. So we advise everyone yun, nga dili lang yun pasagdan ang mga ubusipon, labi na if you have history of wading in flood waters or working in area na mga stagnant water, especially in wet markets, and kato ako yun mga basurero, kukuha og mga waste, kato collect of mga recyclable materials. Really advise to get checked if ever you get sick or get fever or you don't feel well. Especially for lepto, no, ang iyang common yun yung symptoms aside sa fever is body aches, no? Kapoy kayang lawas, sakit na kalawasan, labi na ang muscles sa lower extremities, no, sakit ang mga batiis, no. So we advise if you feel that ayaw ing na lang kapoy lang ka or gabing trabaho, it could be already a sign of leptospirosis.
Okay. Doc, katong sa dengue, I don't know if namo ko'y madunggan, Doc, nga okay ra daw ang stagnant, mubutang bitaw sila og asin. Is it an effective method to do that? Kaya they say nga okay ra daw ang stagnant water, but butangan nila og asin para daw dili mo breed atong mga mosquitoes.
Actually, the best yun gihapon, no, is to cover yun. No? Cover any stagnant water, and check every time if naabay na kay mga kanang larva da sa mosquito, no. If you put asin, then how much asin will you put, no? Saka daghanon imong ibutang. So we advise nga if you really need to keep water, and we assume that you will need not salty water, it's the best way lang good is to cover it and use it properly and then dispose of it if we don't no longer need to stay the water there.
Okay, katong gi-mention po di mo, Doc, in, related to the medicines, no? Dili lang po pataka o medicine. Because I know na with so many people buying online without, they also include purchases online. Yung mga medical, no? I'm not sure if ma-apply antibiotics, but nabitaw nila ng pagpapalit ang online. So, kung may ato ang advice food anak, buy it from the pharmacies, but anybody can sell anything na mag-good online.
Okay, ako lang yung advice no for anything that you would purchase, especially if it's for the purpose of medicine or intake. Just check if it's FDA approved. No, I think the FDA has a website. You can log in any medicine that you have, especially if it's medicine that you cannot read. No, especially if in another language, Chinese or otherwise. We do not advise you because of any medicine that will be licensed to be marketed in the Philippines, it should be in a language that is readable and understandable. So if it's not translated, it means nga wala yun na siyang agi sa ato ang mga regular regulators, no? So we advise against that. Nga naman, kung ingon ka nga giinom na ko di sa ato when I was abroad. Because we do not know what are the formulation, no? You cannot say if it's expired, especially if you cannot see the expiry date or the best before, no? So we strongly advise against that. Number two, it's best gihapon nga you go to the pharmacy. Nga naman, the one dispensing the medicine is a trained pharmacist, no? So they can assess the medication, if kinahanglan ba yun nimo ni at least dosage, no? Kay pwede man yun sa gihapon yung natay mga nasayop lang sulat kay masin og nasayop ang doctor or busy sa iyang muna. It could also be an error, and that's why our pharmacists are advised not to always have a prescription on hand so that they can check if the medicine is proper for you, especially if na kayo makitang mati. Number three is that kanang okay naman ang mga online ng mga selling, no? But for medicines panggo, this is something that we should not be kuripot, no? Because this is something that either could keep you healthy or could make your symptoms worse, no? So that's why we advise we have doctors, we have nurses. Actually, there is already telemedicine, no? I think there are already doctors that are doing telemedicine. Call them and then get the right prescription. And I know that there are also pharmacies that are already honoring e-prescription, no? So di lang yun siya manginahanglan sa papel, no? But they can just write in the prescription. And that could also help our patients in terms of getting medicine safely, no, without getting to go to the hospital for physical prescription.
Exactly. Sakto na, Doc, no? Ang pagkuripot unya can even lead to more serious health issues and even more expenses. Sa atong mga health advice, especially po, Doc, di ay sa local government units, no? Ato ang mga health officers in the LGUs with the start of the rainy season, unsa may ato ang mga hangyo sa ilahan, Doc?
Okay. So to our local government units, no, we advise that since everyone is at home, no, it's the best time to really clean your streets, no, check if the irrigation of your mga kanal nato is declogged, no, so that at least di siya mo cause of baha. Especially karon nga everyone is staying at home. It's very important that they do not have a reason to leave home, no, para iwas COVID, no. And we advise nga especially, no, nanatay mga advisory in terms of storms, public storms, no, mga heavy rains, to labi na kay karon we have actually isolation centers. So be ready for that. Di pwede magsagol nato, no, ang ato ang mga evacuees if there are calamities together with our persons who are under quarantine. So this really is a great challenge for a local government unit to prepare for both calamities, both man-made and natural calamities. So really it's the best time for our leaders to really think about this particular contingencies. Might as well nga karon nga medyo hay patawala pag itay bagyo. And also for our individual homes and families, advice na ginato, no, we follow the same protocol of prevention, hand washing, especially karon aside sa karon yon nga leptospirosis, ubusipon o katong dengue, common po nato karon ang mga gastrointestinal diseases, no? Kay ang tubig nato pwede mahugaw, mainom nimo pwede na siya mag-cause og kalibangan, no? So if ever natay nga na, the best way gihapon to prevent it is proper hand washing, no, before after going to the toilet and before eating. So again, makita nimo no nga all preventive measures actually are the same. It wala gyud siya variation. It all boils down to responsibility and knowing what is good for you and teaching people who might not otherwise think about the particular health concern.
Bitaw. Doc Van, thank you so much for the reminders, and I know that we will be seeing each other again in the next future na itong mga virtual pressers. Kay padayon man yun ang ato ang health campaigns, kay sama sa imong giingon, these are kining mga not only COVID, but there's still a lot of other health issues that we still need to be preparing ourselves against. So, Doc Van, thank you for joining us today. See you again soon.
Thank you, Ma'am Rach.
Yes, Doc. Karon, we will go to our representative from the National Nutrition Council. Nga to ang Nutrition Officer 3, si Ma'am Nasudi Soluta, who will be giving us updates about because the month of July is observed as the National Nutrition Month. Yeah, I remember nga ang PIA interviewed also si Doc Net, ang executive director sa kaning NNC earlier nga naghisgot siya sa celebration of the National Nutrition Month in the middle of the new normal. So, Ma'am Nas, mayong hapon, and Ma'am Nas.
Good afternoon. And Happy Nutrition Month. Wala pa na human ang July, so Nutrition Month paghihapon nantod karon.
Pag-sugod aning pandemic, dapat every month is not na nutrition month na gyud kay everyone is so conscious already of what they're eating, unsay angay kaunon, unsay dapat dili kaunon also. So Ma'am Nas, siguro unahon lang nako ang kining ato ang celebration. Kamusta man ang ato ang pag-observe sa National Nutrition Month in the middle aning ato ang gitawag nga COVID-19 nga new normal caused by the pandemic?
Ayan. So, in Central Visayas, in the region, actually, medyo na-proud po ta sa atong mga local government units kay although naatay limitation sa atong mobilization, wala na ang atong usual na mga bata na nagparade, naglukdulukdog mga utanon, and the normal na naghihimo, naka-adapt raman po ang atong mga local government units. So unahon ako pasalamat ang atong mga local government units for being able to adopt and continuing the advocacy for Nutrition Month. Una sa tanan, kataghanan sa ato ang mga LGUs karon because they have their own official Facebook pages or social media na mga accounts. Dito na sila dito na sila nag-focus sa ilang mga advocacy activities, So there are several activities sa mga LGUs na gipanghimo, like there are a lot of contests na yung mga inana. But outside of kanang sa Cebu City na medyo mas stricter ang atong community quarantine, naapot tay mga LGUs na nagpadayon pud gihapon og kanang medyo physical na mga activities, but then they are also following ang atong mga protocol like ang kanang social distancing, ang pag-wear sa mask, ana. We have katong mga LGUs na nanghatag og food packs wherein na ay mga utanon, mga inana kay we really need to boost our immune system, especially right now. And then there were other LGUs who had started nutrition education para sa mga mothers, na sila lahi-lahi ni sila ng mga nutrition education ng mga activities. But then we're really happy na gipadayon nilang advocacy, especially na kanang they're touching on preventing stunting. Yan. For the region na pod, at the regional level, medyo busy gihapon, may bahala nagwala mi sa office. Bisag ka ng work from home, may tanan, busy na gihapon kay there are a lot of activities. We are continuing our kanang internet radio sa NNC and ang atong social media page. Ang atong mga barangay nutrition scholars po di ay kanang atong mga BNSS, they are holding ang Nutri Balak na kanang contest. So medyo exciting ni siya kay makita nato ang talent sa BNS, way labot na sa atong usual na advocacy. And then na ay mga vlogs, ang atong mga local nutrition program coordinators, ang atong mga DNPCs, MNPCs, nasa lang mga vlogs on COVID and mga inana. So there are really a lot of things. Kana ganing sometimes murag hala puro na nutrition activities ang ako makita sa Facebook. So nalipay ra pud gihapon mi.
That's good, That's good to hear, Ma'am Nas. Meaning to say, posible gyud gihapon nga mapadayon ng atuang pag-observe sa National Nutrition Month. Even if wala tayo physical, no? Limitado ang mga physical nga mga interactions face-to-face. Yeah, siguro at least akong ipangutanan na po sunod, no? Because when you talk about nutrition, there's always malnutrition. Ang katong imo pong nahisgutan ganiha ang stunting. Kamusta man diri, Ma'am Nas, in Region 7, say update nato in the malnutrition rate nato and kani sa stunting nato na problema?
Ayan. For our malnutrition rate, unfortunately, di ba, usually ang atong mga health workers and atong mga nutrition workers, nasanay sila na ay OPT plus naghihimo during the first quarter of the year. Pero karong year, naundang jud siya kay kanang nagpuyo jud sa atong mga balay and ang atong mga health and nutrition workers medyo na focus jud sa kanang COVID response. So ang atong data pa lang is 2019 na OPT, but kanang ang ako lang ganahan kanang focus on is stunting. Our stunting kanang prevalence is still at 10.25%. No, it's still more siya kanang gamay lang kanang 10% naman di ay, so kanang gamay-gamay ra mo daghang moingon, no, like 1 out of 10 lang kuno na bata. But if you put it in numbers, there are 75 children, 75,000 na bata under 5 years old are stunted, which is very bad. Medyo daghan siya. Comparing to the other forms of malnutrition, like underweight, for example, there's only like 29,700 plus na mga bata na kanang underweight, pero kung stunting ang atong gilantaw, makita jud nato na taas jud kayo siya. And that's dili kaayo na siya nag-reflect sa ato maayo because it's an kanang indicator, no, of kanang poor environment, poor na pagpakaon sa mga bata na ay mga most likely mga kanang limited na food supply and mga long-term na mga problems. So mo na siyang indication for stunting.
Ma'am Nas, ako lang baliko, no, because I think medyo naghang ganiha when you were discussing the figure for the stunting, no? Ang stunting prevalence is 10.25%, which is pila to siya ka buok ng mga bata?
75,535. Yan. So medyo daghan jud kay ni siyang bata. Na under 5 years old lang.
5,000. Pila edad ani, Ma'am Nas?
0 to 5 years old lang siya. So kamay jud kaayo ni katong mga younger jud na mga bata nato ang gitimbang nato, no? And then it's still a lot. That 75,000 is still a lot.
But since na-stop man, no, ang ato ang kanang monitoring for 2020 para ma-update na to ang ato ang data, kay 2019 pa man nino, Ma'am Nas, if I'm correct, by the end of 2019, 10.25%. Pero naabay plano ang NNC, I don't know how to continue para mahibawaan nato by 2020 ug asa na tani ni lower bata?
Actually, right now, Monggod, we can't do the whole jud na katong timbangay and pagkuhag height and weight na katong bonggang-bonggang daghan kaayo mga bata magtapok, no, sa mga center kay bawal lagi ang kanang kuan magpaduol. However, nagpadayon ang atong child growth monitoring na mga activities. These child growth monitoring activities, but we're focusing during the pandemic, we're focusing on kanang wasting usa. Kay dili pa man kaya mo kuhag height and weight, kadaghanan sa atong mga areas karon wasted ang gikuha. Wasted is acute malnutrition or makita jud, no, kung unsa ka kanang ang difference sa katong before and after the pandemic na abay changes kanang food security ba sakto bang gipagkaon sa mga bata karon inana. So as of karon ang gigamit nato is MUAC or mid upper arm circumference in many areas where naay kanang kuan dili pa jud strict pa jud ang atong kanang kuan ang social distancing ng mga kanang kuan mga protocol. However, naay mga LGUs, like example, si Siquijor, na dili kaayo, grabe ang kanang kuan na, and then we're really happy to see na wala sila cases, so naay mga ginagmay na pagtimbang, pero dili pa dog full. Ana ang hitabo. So, ang wasting karon, ang wasting nato in 2019 was around 18,949 children. That's still a lot. That's 2.56 na mga kanang bata. And actually, mo ni siya ang gikakuyawan karon sa Regional Nutrition Committee as well as the Regional Nutrition Cluster, which is kanang body na nagkanang handle sa nutrition in emergencies, no? Ang gikakuyawan namo karon was that according to the kanang social weather station na survey bitaw, they were saying that nagtaas jud daghan jud Pilipino ang ingon, or daghang mga tao sa Visayas ang niingon na kanang they are experiencing hunger, no? So kana medyo gikuyawan mi ana kay we had an average of 9.2% in 2019. During the main social weather station hunger, nangutan na sila kung naabay kanang incidents of hunger sa May, mga 14.6 na ingon na hungry sila, naka-experience sila hunger. Pero karong July niabot ag 27.2%. That's a lot. No? So medyo ambak-ambak jud siya. Mao na siyang gikuyawan namo. That's why we're really working with the different member agencies of the Regional Nutrition Committee as well as the local nutrition committees para ipadayon nato ang pag-push bitaw og kanang better food options, better na kanang kuan, and ma-ensure jud na katong mga atong mga pregnant women, mga bata below 5 years old, and katong mga other na mga vulnerable groups mapakaon og tarong. So mauna siya ang atong kanang kuan karon, status of nutrition.
Okay, Ma'am Nas, ang katong gingon nimo no, you cited the survey nga gibuhat for Central Visayas to siya, ang katong 27.2% nga niingon nga gutom na naka-experience sila og kagutom.
Ang kanang gigamit karon sa social weather station manggod is the whole Visayas siya. So Visayas, apel si Eastern and si Western Visayas plus kita. So dito ta na belong ang 27.2%.
Is for the whole Visayas. Wala pa tayo
the whole Visayas.
Percentage for Central Visayas. Wala pa.
Wala sila kanang inana na data. But we're kanang kuan na ni siya. It's reflective of kanang mga kanang kuan na to, mga gipanghimo, and then because it's also reflective of katong mga namagud mi ginagmay na makuha from the LGUs na monitoring no of acute malnutrition katong wasted na mga bata, na adroy increase. Nakikita jud dili ra mi kanang kuan jud sa whole na number kay dili lagi tibok Central Visayas ang nihatag. There's just like a few LGUs na kanang pugihan magpas gihapon, but then makita ra gihapon nato na naadjay increase. Sa una, moderately acute malnourished lang sila, tapos nahimo na silang severely acute malnourished, or sa una kay normal sila na kanang normal ang bata, tapos medyo siguro kanang wala nakaayo nakakaon, so moto na himo pud silang acutely malnourished.
Okay, that's a cause for concern, no? Kana nga point, kana nga question, Ma'am Nas, because of course understandable, ma-explain siya because of the situation nga. Katong gi-mention na limited ang access to food supply and especially nutritious food. Ang access to that is very limited right now. So ako lang pangutana ani, probably with kaning imong gi-mention nga stunting prevalence, stunting is caused by poor nutrition and limited access to nutritious food. Meaning to say, katong malnutrition, stunting, tanan na to nga mga issues no sa nutrition, you're expecting to see an increase in that during karon the next time you conduct a survey dinhi sa Central Visayas.
Right now, there might be a chance that there will be an increase in the malnutrition rate no? We're really hoping na dili siya stunting. Stunting man po, it means chronic na, dugay long term na dugay tang naay problema. So we're really hoping na kanang naamang yung mga gipanghimo pud ang atong mga local government units and ang atong kanang national government agencies in order to kanang stop stunting, no? So mo na siya na kanang naghinaot lang na kanang mapadayon ang kanang mga activities and mga efforts para dili mapadayon ang stunting kay grabe jud kayo ang consequences na kanang may tabo sa ato ang kanang region sa kanang if in case mo increase na pod ang atong stunting in the next na kanang monitoring nato.
Wala pa man tay date, no? Wala pa may timeline ang NNC on the next when it can conduct, no, possibly the next monitoring nato because of the kanang uncertain pa ang movement, no, ang access to the areas. Pero Ma'am Nas, katong imong gi-mention na 10.25% na stunting prevalence in Region 7 for 2019, asa man ang taas among the provinces?
Which province ang taas sa kanang kuan sa stunting? In 2019, pinaka-highest nato would be Negros Oriental at 14.3%. And then we have Bohol Cebu na nagsunod at 13.9%. Ayan. Kung ani nato ihapon ni sila nato by warm bodies, okay, sometimes no murag kanang dili ra siya makakuan kaayo, if atong lang tawon ang atong mga stunted na mga bata, bisag ang Negros taas sila, di ba? As I've said, they were 14%, pero ang ilang bata, ang warm bodies ana is around 11,000 lang. 11,563 children. Ayan.
Katong 14%.
Yes, ang 14%. But, di ba, nagsunod ato is Cebu. Cebu was at 13.9% because lagi dako ang population sa Cebu. Ang warm bodies niya is 28,439. So, mas daghan sila, but dako man ang population. So, muna siyang dako lang tawon ang Negros.
Pero ang total na to nga population of for Region 7 kanang which is mo inyohang gina-monitor for stunting kaning 0 to 5 years old. For latest nimo, I'm sure probably would be 2019, no? Nga
Yes. 2019 pa jud ang among population, it's 736,975.
Okay.
Daghan.
Daghan kayo. Posible pa kuno na daghan no based sa atong madungog na nga mga reports kay wala lagi gawas-gawas sa mga balay panimay, no? So there's a possibility that the population would still increase, no? After ani. Pero Ma'am Nas, siguro with katuno alarming actually that for katong imong giingon kay if dili ma-treated or ma-address right away ang mga malnutrition ng mga issues, it can lead to permanent na nga mga consequences, no, health problems among the children. Nga mo yung mga developing pa, no, future leaders, future nato nga mga citizens. So unsa may ato ang hangyo ani Ma'am Nas? Una siguro for the local government units, murag dako man ang role of the LGUs in spearheading ba kaning mga initiatives and creative solutions siguro in their localities. Unsa may hangyo sa NNC to the local government units regarding in addressing kining ato ang mga nutrition problems?
Ayan. Ang amo jud siguro pinakaunang gihangyo, no, especially karon kay sure jud ko na na-adjust changes in the budget sa atong mga local nutrition committees and atong mga local government units. We still want to encourage all of the local government units to invest on nutrition, no? Invest in nutrition gihapon kay gamay ra kaayo, that's kanang kuan ang gamay ra kaayo na investment sa nutrition, dako kaayo ang atong kanang makita na improvement sa atoa. Ang atoa ra kung ang kanang kuan jud is dili lang unta madikrisan ang kanang ang mga budget sa nutrition nato sa ilang implementation. We have been holding local nutrition action planning with local government units manggod last year, and there was a lot of improvement, but then kabalo jud ko na murag na adyo effect ning COVID sa ilaha karon. So there is a chance na kanang ma-decrease siya. So ang amo jud unang gihangyo jud is dili lang unta kanang grabe jud kaayo ang kanang ang kwaon, no, especially that malnutrition is an indirectly makanang kuan indirectly affected by kaning ato ang limited mobility, no, so daghan jud kaayo ang nakita nato na limitations. The second one is that we should encourage continuous na breastfeeding, no, activities for mothers, no, especially katong ato ang mga children na 0 to 23, no, and then continue pod ang atong mga programs and services for mothers, pregnant mothers especially, and their children up to 23 months or 2 years old. Maulang jud ni siya ang pinaka base nato to prevent stunting, no, so mura jud ni siya ang among gihangyo na kana jud ang tuwa dun kanang really ipabilin ang investment on nutrition, and then the second one would be to really invest on the first 1,000 days. The first 1,000 days as in katong pag-start nilag pagburos sa mama, pregnant pa si mother, hantod sa pag kanang 2 years old nila, that's really the key to prevent stunting. So we want that to enable pod na kanang our children have better nutrition, and pati ang mga mama para pod dili kaayo dako ang ilang chance of kanang infection, malnutrition, and tanan-tanan na ng mga kanang kuan consequence ana apil na ng mga kanang kanang reduced na intelligence, kanang mapuro sila pagka when they grow older, mga inana ba. But then dito lang gamay ra jud kaayo is just 1,000 days. So we really hope na kana ra jud ang ilang gi-investan karon.
Yeah, Ma'am Nas, ato ang mga hangyo sa mga ginikanan, the people, kani especially parents who mo decide, no, unsa ang pagkaon, who prepare the food inside the households, nga in the middle of the pandemic, medyo lisod man gyud ang access to kining nutritious food. Kay medyo masayon gihapon karon ang order na lang take out, no, from restaurants. So unsa man pud ato ang mga advisories, what's our appeal from NNC to the parents?
To the parents pod, actually ang pinakauna jud namo, especially for those who are breastfeeding, we're really happy na dili inana kadaghan ang atong EO 51 na violations. That's the milk code violation, or ang pag gamay ra ang nag-violate ana, meaning gamay ra ang nag-donate, among nakita na nag-donate og gatas. Bawal na siya, so reminder na mo, bawal ang donation sa gatas. But then ayan, we're first nato na nagihangyo sa atong mga parents would be especially for mothers na naara man pod sa balay karon, di ba? They don't have to go to work. So we really hope that they continue breastfeeding. Especially na naara man pod sila dara, they continue breastfeeding. They try to breastfeed upon kanang ganahan ng ilang mga anak, magpatutoy sila right there. And then the second one was that naano man gud lamang ta sa balay, and then ang kanang kuan, the Department of Agriculture in coordination with many local nutrition committees have provided mga seedlings bitaw. So katong mga kami dugay na ni kaayo namo na advocacy, kada ganing we are trying to advocate for home gardens. So karon na feel na nato, no, na ay may padayon nagtanom mi sa una na ata may mga panglamas karon, ina na siya ba. But then ayan, we're really trying to advocate paghihapon, no, kay wala pa naman ta kabalo kanus adyo ta maka freely laglaag. So we're really advocating for that, no, kanang mga home gardens. It could increase nutrient intake sa ato sa gamay lang jud na nutrient intake, it will really help us boost our immune system, help make our children be more healthy, and kanang make sure na ang ato ang mga pagkaon are nutritious enough. Kung wala na jud choice, kabalo naman jud kung especially in urban areas na jud walay choice, no, like dili jud sila ka tanom, kay dili ilang yuta or mga inana. First we can try container gardening. Or if kanang order na jud, let's say sige nagkanang kuanta, mahilig ta order og food, we really hope that you could still continue to make nutritious and healthy food choices. That means na dili lang siya puro carbohydrates and puro meat, no? Na apilan jud unta nato og kanang kuan, og kanang utan and fruits. Mora jud nang among gihangyo. Kay bahala na lang na kanang dili siya na full jud na kanang daghan jud kaayo makaon, but then as long as you're following ang atong pinggang Pinoy, no? I think na discuss sige namin namong gi-discuss sige. As long as mag-follow nato na go grow glow ang ato ang mga pinggan, we're really sure na kanang at least man lang duol na siya sa healthy. Siguro one thing lang that I might add, gahapon manggod the National Nutrition Survey came out. No, this is done by the FNRI, and we're really sad to see na daghan di ay kaayong inadequate ang atong nutrient intake. So, okay na ta. Go na ta sa carbohydrates. Sige, carbohydrates, rice, bread, mga na. Medyo okay na ta dala. Ang kanang kuan, ang katuna pong meat, poultry, medyo doon na ta pa, okay na ta gamay. Especially kay karon, we're doing a lot of kanang kuan. Campaign to eat katang mga high protein betaw, so like eggs, mga na siya. So, okay lang siya. But then, nakita na mo gihapon na medyo maba gihapon ang atong intake sa fruits and sa vegetables. And because of that, the consequence is there is inadequate na kanang kuan nutrient intake. No? Ang pinakasad pa jud ani, kabalo mo karon man jud kay kanang kuan uso jud ang pag-boost natog immune system. But ang pinakasad na mo na kanang bawaan gahapon according to the survey was that ang isa sa pinaka-inadequate na intake nato from the food na nutrient is vitamin C. Imagine that, vitamin C na mas dali ra kayo ng kanang kamatis na anana siya ba? Daghan kayo siyang sources na pwede natong pagkakuhaan. But then nakita di ay na most of our household consumption has an inadequate vitamin C intake. So ayan, kanang that's something na kanang kuan nato. So for the households, first, breastfeeding, exclusive breastfeeding for mothers, especially katong 0 to 6 months, no, na mga ang ilang mga anak. Second is continue gardening, kung kaya nato mag-household kanang backyard gardening or container gardening man lang para natay makuhaan og gamay na kanang fruits and vegetables. And third, if you have no choice and you have to have kanang magpa-deliver lang mo food, please make the right and healthy and nutritious food choices. Mo na siya.
Ma'am Nas, no, just a quick question. Regarding anang katong sa survey na gi-release findings from FNRI, no, food research man ni siya, di ba? Institute na survey. Unsa nga period ang coverage ani, Ma'am Nas?
Ang ilang coverage ani would be 2018 siya na data nila. But karon lang nila gipagawas. Oo.
Okay, oo. Because siguro ang kaning sa vitamin C, ako lang i-raise nga base siguro because people are depending on the vitamins itself. Dili coming from food, but coming from kaning tablets, no? Di pud kaha maunay nahitabo. That's why they are lesser ang consumption sa food because nagsalig sila sa vitamin C. Pero unsa may ana, naabay statement from NNC regarding that? Kanang nga better ba ang vitamin C coming from food nga kaysa anang you buy the bottled vitamin?
Ayan. Kanang kuan. Well, first, wala pa kanang official statement. Kagahapon lang gani ginilagi pagawas. But then, kanang kuan, ang indicator manggod niya siya, vitamin C manggod is found in a lot of kanang vegetables and fruits. No, like green leafy vegetables, kanang mga kamatis, kanang bell pepper, mga kanang mga ginagmay lang ba na mga pwede ra jud nato usually maabot ra jud nato. However, nakita nato dere na because gamay inadequate ang atong kuhaani, it is reflective of really a decrease of kanang kuan consumption of fruits and vegetables. Mura jud na siya ang kanang kuan niya, indicator lang jud siya na di-decrease jud siya. So I think that supplements are helpful kay para lang to add to supplement, but then it also indicates na dili ra man pud usa lang ka supplement ang kailangan, mao pud nang advocate pud ta og kanang food jud kay mas dali kanang kuan magamit sa lawas, and daghan pa jud siyang different nutrients. So
Sakto
let's
na, no?
fiber and so on.
Oo, sakto, no? It's an indicator of the food choices, the poor food choices that we make. Yeah. Kaning mag-stress eating manggod, ngano siguro walay mag-stress eating of vegetables, no? Ari man gid mag-stress eating sa carbs and calorie-rich na mga foods. And I-mentioned pa lang po na ako, Ma'am Nas, no? In relation to what you said about kaning vegetable gardening, because the Department of Agriculture actually gives out free seedlings to the public who's interested, no, in coming up with their own vegetables para there's a quick access to healthy food right in their backyard. So mo nang i-mention lang nato for those who are interested, pwede lang mo muduol sa Department of Agriculture, no, the nearest DA office near you, pwede mo, or sa LGU ninyo, inyong agriculture officer sa LGU, you can also ask for free seedlings, kaya aduna sila free vegetable seedlings na ipanghatag. So Ma'am Nas, thank you so much for the reminders, no? I think they are very timely because karong panahon na dako lagi kaayo ang kaning emphasis nga gihatag on health and nutrition because of the health pandemic niya. Murag dinha gyud ni gawas ug unsa ka importante i-boost ang immune system nato. So hopefully lang, Ma'am Nas, the next time nga maka-invite pud ang DOH sa inyo, no, for the BIDA Solusyon Virtual Presser, kanang naa na tay results for because I think that's mo na gipaabot pud sa kadaghanan unsay latest nato nga data for this year regarding kaning nutrition status sa ato ang mga bata, no? Kay murag naapektahan man gyud ang communities, the access to food, nya katong imong giingon nga back in 2018 mas daghan ang nisulti nga they have experienced hunger in Visayas. So it would be interesting to find out unsay resulta unya sa latest nato nga mga survey for this year.
Ma'am, ang katong for this year nato na survey was July of this year, katong 27.2%
Okay,
para sa hunger.
Yes.
Oo, July ta siya.
The May is 9.2. Sakto ko, no? May Monday to this year ang 9.2%.
May of this year was 14.6%. And 9.2% ang last year na average.
Okay. So meaning mo tong dako kayo nga jump, no, between
from 9.2 last year to 27.2% this year. Medyo dako dugay siya.
Pero mo na, no, tungod sa sitwasyon nga atong giatubang. So thank you kaayo ang ato ang representative from National Nutrition Council, Nutrition Officer 3, Ma'am Nasudi Soluta. Salamat sa imuhang mga updates nga gihatag. And of course, no, ang ato ang mga reminders nga gihatag sa ni Ma'am Nas for the LGUs and also the mothers, no, the parents, and what they need to do in order nga prevented sa ilang kaugalingong mga anak ang kining mga malnutrition and the consequences of malnutrition. So thank you so much, Ma'am Nas. Pwede na to as a, siguro to wrap up sa imuhang discussion, ma-promote na to, Ma'am Nas, unsa inyong mga social media accounts, because I know nga naamoy gipang post dito nga mga nutritional information, no, mga advisories as well nga makatabang sa atong publiko. Sige, Ma'am Nas.
And I think we're sharing right now on our Facebook page pag sa inyong live. For everybody in Central Visayas or whoever is tuning into this kanang kuan program right now, you may like our page. You can ask questions at our page. That's NNC RVII. So sa Facebook na siya namo na page. We also have a YouTube na account. If you need to kanang look into mga kanang kuan nato, mga news nato, and our internet radio is there. I would also like to grab the opportunity to invite everybody for our virtual Grand Nutrition Awards. So if there was a Grand Nutrition Award sa una, na kanang physical, we're having a virtual one this year, and we're recognizing a lot of kanang mga COVID na mga efforts na gihimo sa ato ang mga health and nutrition workers, as well as ang atong mga local government units, as well as katong mga social media na mga accounts sa atong mga local nutrition committees. So medyo daghan gihapon tang activities. Kay next month is breastfeeding month. So we're kanang inviting pod everybody, no? Daghan kayo pang gi-invite to continue the breastfeeding, and whoever is interested na puntay ka ng activity on our breastfeeding, you can check that out sa among page gihapon. Happy Nutrition Month, everyone!
Happy Nutrition Month, Ma'am Nas. Thank you for joining at ang BIDA Solusyon Virtual Presser today. And we look forward to more updates unya from NNC in the coming weeks, since nagpadayon pa man gihapon ang ato ang health information drive. So, thank you so much sa ato ang mga guests from the Department of Health for this episode sa ato ang BIDA Solusyon Virtual Presser. Nakahatag ng COVID-19 ng mga updates gikan sa ato ang spokesperson nga si Dr. Mary Jean Loreche. Unya aduna po ito'y mga health advisories si Dr. Van Baton for the especially rainy season na karon. So how to protect yourself against waterborne diseases such as leptospirosis o kaning dengue nga nagpadayon gihapon nga mga kaso nga reported dinhi sa ato ang region. So hopefully ang katong naminaw nagtanaw nato karon na amoy mga napupo gihapon ng mga information kay kapadayon ang atong information campaign on health related na mga issues, programs and advocacies of the Department of Health here in Region 7. Kini si Rachel Nesha in behalf, of course, of the Regional Director of PIA, Paya Trinien, and also in behalf of the Health Information Unit nato sa DOH, ang team nila nga for making possible ang ato ang weekly BIDA Solusyon Virtual Presser. Thank you so much. And please watch us again next week, Wednesday, same time, alas 3 na hapon, rather 3 in the afternoon sa Facebook page of the DOH Central Visayas and the Philippine Information Agency in Region 7. Maayong hapon ug amping tangganan.
Ang COVID-19 ay panibagong kontrabida sa buhay nating mga Pilipino.
Habang unti-unti tayong bumabangon muli, patuloy ang laban natin dito.
Para matalo natin ang kontrabida, we can beat the solusyon.
Kaya mong maging bida, basta susundin ito.
B. Bawal walang mask.
I. Sanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
BIDA Solusyon sa COVID-19.